What's up, everybody? We got a few people in here already. Let's see here. Can you guys see us?
Join the queue.
We got D. Lynn. We got Roel.
Wow. Y'all are on top of it.
One step forward. What's going on YouTube? We're gonna do a quick little
This is great.
sound check. Do you mind sound checking for me?
Sound check. 1, 2, 3. Brothers in the house.
He is here. You guys know who's to my left. I believe that's to your right. That's my brother Andy Rogers. We're sound checking it.
You know, today at the office, I've been working out of the Knoxville clinic. Shout out to West Knox. We're at our North Knox clinic right now. Like that branding right there.
Yeah.
North Knox. Looking out at the park in Fountain City. It's a beautiful day in the neighborhood over here. Sun shining. There was a little bit of a question for the Rogers family, Ben. Not many people knew the birth order.
Who? On the team?
On the team.
Really?
There were, of course, April, who has been with us for so long and looks so young. April, a beautiful soul.
Shout out April.
She got it right. She knew.
Really? The rest didn't know?
I'm just going to say there were some wrong answers. And
really?
I was shocked. I know it's sometimes hard to tell because my face is frozen in time. Thanks to Brittany in our Johnson City clinic, you can't tell, but I am raising my eyebrows right now.
You are shocked.
I am shocked. I have actually a really good before and after video of that I sent to her, sent to Kelly too. It might be on our performance medicine aesthetics Instagram. What's it called?
Glow up with Kel.
Glow up with Kel. Glow up with Kel.
Yeah.
Glow with her. So we might do a little bit of a quiz for everybody here who thinks who's the oldest, who's the middle, and who's the youngest of the Rogers kids.
Anybody know? Now, Carter. I see Carter and I see Rachel.
Yeah, Carter,
you guys
Rachel,
can't answer.
Not count.
You guys can't answer. I see. I just want to give a few shout outs. Lisa, what's going on? I hope you're doing wonderful. Robert, what's going on? Stan's in the building.
Yes.
Thank you guys for hanging out with us.
I just want to say a special shout out to Barbie.
Yeah.
Nurse Barbie. Rachel. Hi, Barbie. Barbie.
I love it.
We call each other Barbie.
You guys know the drill. We're taking questions tonight. We're gonna do live Q&A, all health and wellness questions. Put them in the comments if you have one. We took a few that came in throughout the week. Thank you guys so much for all those who do that. Thank you. That really kind of sets up the show so beautifully. And we do have a coupon code for tonight for those who want to, if you're wanting to purchase a vitamin, we talk a lot about them on this show. For those who listen live, we try to give a little bit of a discount. It's a 10% discount. We change the code up the coupon up every single Tuesday. Tonight's coupon will be, it's not what I wanted. Where am I at? Okay. Tonight's coupon will be this, Live Q10.
Live Q10. Like Coke Q10, Live Q10.
Actually, that's pretty cool. Yeah, I wasn't thinking about that.
Thank you.
Yeah.
Were we not? Was that not why it's called Live Q10?
No.
Oh,
it was Live Q10 because 10% off Live Q.
Oh, well, Coke Q10, Live Q10. Yeah. Coke Q10 is in some of our vitamins in our, it's in our energy formula. Coke Q10 PQQ.
That's right. It is. It is in the Coke.
So get your Live Q10 off of your Coke Q10 with Dr. Rogers Energy Formula.
I love it.
I have to say, okay, these vitamins, sometimes with the Rogers family, I'm like, really? These vitamins are the bomb. I've been on all of them for now consistently for about 6 months.
Yep.
My labs have never been better. I've never felt better. My hair
looks great.
You can see it.
Yeah. Speaks for itself.
I love these vitamins. I'm all about it. I'm all on the Rogers vitamin kick. And I know it's our family vitamins. We have to like it, but I really like it. If awesome. I wasn't part of the family, I told someone today that I wasn't related to the Rogers. They hired me because I looked like Dad, and they believed me. And I felt bad. I was like, I'm just kidding. We're related. We're related.
I'm going to put this up from Lisa. This is correct.
Ooh,
this is correct.
Yes.
Yes.
You are spot on. It is Kelly with an I. That's okay, Lisa. Not many people know that, but she's Kelly with an I, and that's beautiful there. Ben, Kelly, and Andy in that order.
Yep.
Ben is the oldest. He's the patriarch of the siblings. Kelly right there in the middle, classic middle child. If you've ever seen those videos about the oldest, middle, youngest,
we're it.
That's us. And then Andy, the baby, spoiled, rotten. Got whatever you wanted.
You're so perfect. You're so
got
perfect.
all the braces.
Guys, we're taking questions. Go ahead and put them in the comments. We are going to get to, we're going to start off. Look at Dustin's in here. Dustin, what's going on, man? It's so good to see you.
Are you and Carter just in the same room?
I love
Dustin
it.
And I love it.
Rachel, we got to get Robbie in here. Let's get all the families in here. Let's go. Let's go. All right, you ready to start?
Yeah, let's do it. Let's answer some questions.
All right, guys, we're answering questions now. If you have a question for Andy, go ahead and put in the comments. This first question is, what is recommended for occasional psoriasis? It seems to be becoming more prevalent and with several spots versus what once was one at a time. And then goes on to say whatever's recommended. Do you take or use once spots appear or all the time? What's your thoughts on this?
I don't know if this is like for me because you knew I was going to be here this day, but I have psoriasis. I've dealt with psoriasis and psoriasis flares. Rachel, Barbie, can I get an amen? I deal with psoriasis flares and she helps me out with them. But absolutely. So psoriasis is an autoimmune process within the disease, within the skin. So whenever you're looking at skin, you're really looking at, is it inflammatory? Is it viral? Is it bacterial? Is it fungal? How are you going to kill it? But a lot of what happens, it's very hard to tell. You're either going to give it steroids or you're going to give it doxycycline. That's like the two things that you use for skin. Psoriasis is a little different. So psoriasis looks a lot like eczema. It looks a lot like seborrheic dermatitis, which is kind of like cradle cap for kids. So all those look very similar. Sometimes they'll actually take scrapes and look at it under a microscope. Psoriasis usually lives in hair-bearing areas. So you're looking at right in the scalp. You're looking kind of on the chest for men. Sometimes you can look at it in the beards or the back of the nape of the scalp. Sometimes you can look at it here too. It's redness. Irritation does have a yeast component to it, but psoriasis is autoimmune. So sometimes when the gut health is off, your skin health can be off too. So psoriasis flares during times of stress, whether or not it's environmental stress, food stress, or just circumstantial stress, and usually looks red and flaky. So what do I use for it? I use all the stuff. So you can, what is recommended for occasional psoriasis, so you can spot treat. Usually you use topical steroids. If you're looking over the counter, you're looking at hydrocortisone, sometimes hydrocortisone with aloe. If you're looking at prescription, I like to use fluocinolone topical. That's also can be in solution form. It can be in cream form. It can be in there's cream, there's solution. I use solution for the scalp. I use cream for the face. You don't really want to put a high potency on your face. If it's on a lower face or the body or the trunk, you can use a higher potency, but fluocinolone 0.01%. It's either 0.01 or 0.1%. There's also something that I want you to look up. It's tacrolimus or tacrolimus, I forget how you pronounce it, TACROLIMUS. I use that and love it. That was something from a dermatologist that she recommended. If I notice flares start to come up, I will use that kind of in the T-zones or kind of in the chest, and it'll help prevent those. And ketoconazole. So ketoconazole will help out. There's a fungal component. There is kind of a dewormer, like an azole can help. So you're really looking at almost like a parasite in your belly. We've been big on parasites lately because we have a new CellCore cleanse that we're offering at the clinic with Margot in our North Knox Fountain City clinic. But ketoconazole will work. So I want you to look up fluocinolone, ketoconazole, tacrolimus. Those are all prescriptive versions to get rid of it, but those are going to be the best ways to do it. If you're looking at it more holistically, you can look up 1,000 different kind of old wives' tales about how to decrease. I've looked up people who put honey on their face. I've had people cut out a bunch of different foods, glutens, dairy, really increase water, work on gut health if you're looking all natural.
Now you're currently doing CellCore right now, right?
Love CellCore.
And is that did you do it for the psoriasis?
Usually my litmus test if things are working is if psoriasis is clear. And this is helping. Too, I'm still getting flares on it, but absolutely it's less severe and usually clears up pretty quickly when I use that spot treatment I'm talking about.
If there's anyone in here live with us tonight who wants to know more about the cleanse that Andy's talking about, put them in the comments because Andy's literally going through it right now. So this is the perfect time to ask those questions. Karen, I see you. Thank you, Lori. I see you. So good to
Lori,
see you.
what?
Look at this. Tina's in here.
Lori,
Tina's giving the Patrick Dempsey vibe.
Tina, God,
Man.
they don't make them like you, Tina.
That
They
is
don't.
that is
Patrick Dempsey vibe. That's so nice.
that is quite the compliment, and I agree with
I
you.
will take it.
I
I'll
agree
take
with
it.
Yeah.
I'll take it. Thank you so much. Thank you.
All
No
right.
one's as dreamy as you, Tina. Okay, that's true. That's the truth.
All right, let's keep going here. Thank you, guys. Let us know if you guys have a question for Andy. We're going to get those to in just a second. This one came in over email. Can TRT for a 60-year-old male cause back acne?
Yes.
And next question.
I'm just kidding. I'm sorry. Yes, it can. I'm sorry. I was just trying to make them laugh. Yes, it can. So testosterone, it's an oil. It comes in an oil form. It's androgenic. So if you think about everything that testosterone can do for the 18-year-old male, it can do for you too. Both things that we want and things that we don't want. So there are the good things that we want. It brings about energy. It gives you better sleep, better sex life, improved mood, less belly fat, more muscle. Have you ever met the 18-year-old that can eat 3 plates of Motos and garbage and look shredded without really working out that much? That's what testosterone can do for you. But it can also do the other things too. It can give you that oily skin, the acne that comes with it because the oils block the glands that then can't, that traps the bacteria and causes acne. So yes, absolutely, this can cause that. Certain ways to kind of decrease that appearance. I've worked with a lot of patients on this. Sometimes it's hard that if you were prone to acne as a kid, you might be prone to it again whenever you reintroduce that hormone. So sometimes it's hormonal acne. And a lot of it is because it's an androgen, and androgens can be oily. So things that people will do is they'll change the attachment. So there's testosterone cypionate, there's testosterone enanthate, there's testosterone blends. We're trying to get the blend back. We don't have that back. I'm so sorry, Carter. I'll never say that again. And then sometimes too, people will go on a subtler version of testosterone. So if you're getting these big boluses of testosterone once a week, you're more prone to side effects because your body doesn't know what to do with it. When you're naturally having testosterone as a younger man, it's not coming in once a week in these big boluses. It's coming every day and kind of sustaining at this high level. So some people will break up their testosterone injections so that they'll lower the dose and increase the frequency, or they'll change to pellets or creams, something a little more subtle. I don't want to say less potent, but more subtle.
Is that like only if it bothers you, or are you saying if you have back acne, you need to change something? Or is it like, hey, it's bothering me?
You can change something. Yes. Okay. So I guess it depends on if this doesn't, it would bother me.
Okay.
Or two, I would say if there's a different way to do it, then yes.
Okay.
And so then two, sometimes you can just treat it as acne. So it would be a supplemental treatment where you're looking at doxycycline, spironolactone, even erythromycin or clarithromycin. There's another one that people use too that help out decreasing. You just kind of kill the bacteria. And to even doing like tretinoin and things that can actually treat acne, you can do it on your back as well. It's tough. It's tough. Whenever this happens, especially when you're in your 50s or 60s and it hasn't been there for a while, a lot of the times it's that influx of hormones that's an androgen. So that's typically the problem. So if you can use spironolactone, it kind of helps flush out some of that oily side effect. If you do that, you don't want to take potassium because spironolactone hangs on to potassium. You can be potassium overload if you take it. So yes, if they're on this, they should see one of our providers and we can help out.
Such a great question. Thank you for saying that. And I'm going to just give a huge shout out to the Instagram people. Thank you guys for being with us live. T-Von, I see your question. We're going to get to that in just a second. Hang on with us. We're going to take live questions here in a second, but I see, goodness, Diane's in here. Lex is in here. A-Team, what's going on, guys? Thank y'all for hanging out. We're going to get to live questions shortly. Shout out to the Instagram fam.
Instagram fam.
I see we got our Bristol team in here with Katie
Bristol,
Lynn.
what's up?
Kelsey, I hope you had a blast over in Destin.
Are y'all not tired of work and y'all are here? Y'all,
amazing.
Thank you. I'm coming to see y'all Friday. I was actually about to text y'all. So tell Jill that too. I'm coming to hang out Friday.
And also,
although Bloom closed. What?
I know. It's a bummer.
That's a bummer.
But that's you got to be at 9 a.m. JC. If you guys want to see
Andy. Tell Andy I said. Y'all, when Lucas and I get there on a day, Carter, you can tell them it gets wild. It gets wild.
Love you guys. We're gonna get
9 a.m. I will be there. I'm driving in the morning. I played a trick. I tried to play a trick on Carter last week that woke up late. And I didn't. I was there, but it didn't matter.
Well, with the drive, we have a methylene blue question. I'm assuming you're going to take some methylene blue before the drive.
Yeah, I'm on the blue. I will not miss the blue.
I don't either now. I've got the blue thumb. We're gonna literally, I got the blue thumb.
Oh my God, you do. You should cut your nails too.
All right, this question is, I've been using the methylene blue for a month now, and I like it so much. I recently added taking beetroot powder as well. I take them about an hour apart. Question is there any reason I should not use the beetroot while taking what I call blue meth? I love it.
Lols.
I love it. I love it.
No.
Okay.
No, absolutely not. No, those are not contraindicated. When you're looking at contraindications for methylene blue, there's not a ton when you're taking it orally. IV methylene blue is going to be a little bit different, and really you're looking at its side effect profile because it can increase norepinephrine, which is a neurotransmitter in your brain. And if you're on drugs that increase norepinephrine or the presence of it, or decrease the reuptake of it, then that may make it more prevalent, or where you're looking at something called serotonin syndrome, not with beetroot. So beetroot is going to it's like nitric oxide. It's a vasodilator. I wish I just had this. I just drank beet juice.
Really?
Like on the way here.
No kidding.
Yeah, it was amazing.
Man, I've never had
Whole
it.
Foods. I don't know if you've ever heard of it. Ben doesn't like the grocery shop.
Yeah.
It's okay. It's okay. We're trying. We're trying. But yes, can you take this at the same time? Oh, sorry, I was crossing my legs. It's a little shaky. Not an earthquake here in North Knox. Yes, you can take this at the same time. If you're looking at best practices with methylene blue, doing it with some sort of vitamin C, 1,000 milligrams. Some people will do it with red light therapy or being outside to help activate it, because methylene blue is working on the mitochondria. So you're working on the electron transport chain and the mitochondria, the powerhouse of the cell, to flush it out and make more ATP. Red light therapy and vitamin C will help get it into the cell a little bit better. But no, not contraindicated. That's great. Those are good things for you. I'm glad you like the methylene blue. I do too. I love it. I love it.
Such a great question.
That's a good one.
I see my mom's in here. Mom, what's going on?
Oh, Mama B.
I love it. And I'm actually going to do this for Mom because I see an old friend in here. John's in here. And John, I just love you so much, man. It's been so long. Gosh, I feel like I grew up around John in Oak Ridge. So, John, thank you for being here, man. I miss you. I hope you and yours are doing amazing.
Can you believe some Oak Ridge?
I wanted to put that up for Mom because I know.
What's your favorite Oak Ridge memory? Daily grind.
Beating you in tag.
We never played tag. Okay, Ben was on the tennis court. I played by myself. I played tag with the tree out back. Okay.
We've got a Cleveland. This is an LDL question. All right, my 6-year-old husband's LDL has steadily gone up past the past recent years. Question is, could this be caused by either hypothyroidism, which was brought on by radiation treatments, or his testosterone replacement? Really good question.
I'm so sorry.
Yeah.
Too, with hypothyroidism and radiation treatments, that's tough. So LDL, low density lipoprotein. This is typically the fluffy cholesterol that tends to be fluffy and sometimes sticky depending on the pattern. Testosterone replacement does not increase LDL. So there's not a pattern that goes along with that. Testosterone is from cholesterol. It's from pregnenolone. So pregnenolone then which is a mother cholesterol, a mother hormone made of cholesterol, then cascades down into testosterone. So there is a relationship to cholesterol. It's with pregnenolone. It's not with LDL. And that's also to something that you don't necessarily monitor when you're giving testosterone replacements. You're monitoring your blood counts, your estrogen conversion, dihydrotestosterone conversion. Sometimes you're monitoring your liver function. So I would say no, probably not from testosterone replacement, though it could be that LDL typically, it's almost like as your car ages, everything kind of gets a little bit worse and junky. And it's like the buttons and the dials don't work. So LDL can increase with age. So I would say from testosterone replacement, maybe secondary that it's the aging process, and now he's on testosterone and LDL happens to be going up. However, with hypothyroidism, And radiation treatment, radiation kills tissue. So as it kills tissue, it can also kill cholesterol. It can kill cholesterol, and your body can make more as a response. So I'd say if it's between the two, I'd say it's more than likely one, or even most likely, if it's Occam's razor, the most likely answer is just from the aging process, or from genetics that you might just have some or this patient might just have some hyperlipidemia. But to remember radiation. So if you're thinking about things that kill tissue, if you're looking at killing an organ, so sometimes with a hyperactive thyroid or a big tissue thyroid, you kill it with radiation. You're burning it. So there's also chemo for cancers poison it, and then surgery cuts it out. When you're messing with tissue, you do mess with cholesterol, because every cell membrane that we have in our body has cholesterol in it, sterols. Sterols make up the cell membrane. So you're decreasing cholesterol whenever you burn tissue, and your body in a response can make some more.
That's a really great
specific question. That's cool.
I love that.
But also too, I would encourage him, if it's a worry, like are we worried about the LDL? Yeah. I would get a Cleveland. I would see what type of LDL it is, what the breakdown and the fractionated look of it is, the pattern, and then look at apoproteins or lipoprotein little a. Those are going to be a little bit more, along with the CT calcium score, to see calcium buildup within the arteries. Is it going to stick to anything? Is it a lot? And that's a lot of the fluffy big ones. So I'd say looking at a more detailed look than just LDL to see, is that actually going to do anything with an occlusion or like a traffic jam in the heart?
Such a great question. I hope that helps a little bit. Thank you, Ange, for that wonderful answer.
Is Rebs in the house?
Rebs is in the house, and I was going to mention this. But Rebs is here.
Oh, Rebs. Rebs and Tish, Taylor Tish.
They're the best. They're the best.
I texted yesterday. We've known each other for 20 years.
That's amazing.
20 years. I know, Rebs. You can't tell by the look at my face, because it's baby smooth.
Because it doesn't move.
We are older now. But Rebs, I'm so glad you're on.
Rebs, thank you for being here.
So
I see so much family in here. Thank you guys so much. Grandma Mary's in here. We just have such a great crew. Thank you, Linda. Hello, what's going on? Great to see you. Thank you, Peggy, for the
Linda.
feedback.
Well, I saw Linda when I was walking around downtown Kingsport.
Did you?
I did. I said, hey, what's up, girl? I love Linda.
All right, I'm going to go to Instagram real quick. If you have a question for Andy, this is the live portion of the show. T-Von has been super patient with me, so thank you, T-Von.
Yes.
We're going to get her question. For those on Facebook and YouTube, I can't put this up on the screen, so I'm just going to verbalize this. This is from T-Von on Instagram. Her mom dies of breast cancer, had trouble getting pregnant, is very scared about doing HRT. Thoughts. So I'm assuming, T-Von, that let's see if that's, oh, there we go. Let's see if I can, okay, here we go. My daughter-in-law, who is 24, had blood work done and has been told her hormones are way out of whack. Does that happen at such an early age? A little context is her mom died of breast cancer, had trouble getting pregnant, and is very scared of doing HRT. So I'm assuming this is around cancer and getting on hormones as a woman. Is that enough context?
Yeah, I'm so sorry. That's a lot to, So, okay, the question, so just to put about 24. Okay, does this happen in an early age to have hormones way out of whack? Sure. Yeah, at age 24, that can happen. However, with females and with hormones, they're different at different parts of the cycle. So it depends on what they drew. So with female hormones in the 28-day, a man explaining
I know.
Me mansplaining.
I know.
Cycles, I'm so sorry. But yes, this through the normal 28-day phase. First 5 days is usually menstruation with bleed, 0 to 5. 5 to the middle, 12 is going to be the follicular phase, when you're kind of going into the ovulatory phase, days 12 through 14. 14 through 28 is luteal. So it's like we get the shedding cycle, so we're starting over. Are we going to make a baby? Did we make one? Are we keeping it? And then done. So that happens every month. So it depends on when they drew that lab, what the relationship to the lab is. Are the cycles within normal limits? Are you having them every month? Are they pretty predictable? So hormones can be out of whack, but the number doesn't always tell the story. So I'd relate the number to when in the cycle it's happening and what actually they drew. Is it estradiol? Is it progesterone? Testosterone doesn't change that much throughout the cycle. It's a little bit more steady, but your estrogen can fluctuate crazy amounts of numbers. If you're looking at hormones being out of whack with a young female, I'm looking mainly at PCOS, and PCOS is going to have an insulin component too. So I'd say adding that to the picture might give you a clearer indication about why the hormones are out of whack, or you got to relate it to when you drew it. Technically, if you're looking at, for a female, her age 24, you're looking at days 19 through 22 being a little bit more of the best times to draw, where you're going to get a pretty accurate read about where estrogen and progesterone are, and especially estradiol. If she's worried about, if her mother had a tough time getting pregnant and she's worried about having a tough time getting pregnant, definitely see Robin. She does functional fertility and looks a lot more into detail with hormone labs, but also there's some anti-Mullerian hormone you can check to see what your egg reserve looks like. And then also to see the other confounding factors that get in the way of pregnancy. It's a lot harder for females right now to get pregnant. And it sounds too that if we're looking at cancers, if her mom had breast cancer, is that the second part of it?
Second part is seemed that mom passed away of breast cancer, had trouble getting pregnant, and is scared of doing HRT. And I'm assuming this is the 24-year-old.
So if someone in your family has cancer, it does not necessarily mean you're going to get it. So I would say it depends on the type of cancer that her mom had. It would depend too about whether there's a genetic component like the BRCA genes, so she can get BRCA tested to see what her chances of getting it. I don't know what they're trying to give her as far as hormones. If she's scared about doing HRT, I'm curious about what type of HRT they're trying to give her. Is it birth control? There's a camp of people who think birth control is not good for you at all in any bit, that it actually really increases your risk of cancers, of actually never getting pregnant ever. So birth control, what it is doing, it's synthetic, usually synthetic hormones, except one bioidentical version of it. I forget the name of it off the top of my head, but it's slowly giving you hormones all the time so you don't ovulate. The rise of estrogen during that day's, remember, Vin? Days 0 through 5, menstruation. 5 through 12, rise of estrogen going into ovulatory phase. That rise says there's an LH spike. I need to ovulate. So too, birth control doesn't give you that spike. So it's always giving it to you a little bit. So there's an increased risk with birth control. It depends on what type of HRT they're trying to give her. So I would say, if it were me in that question, I would see Robin, and I would say, let's look at this from a functional fertility standpoint to see what I would need to do about getting pregnant, and also looking at MTHFR. MTHFR mutations can absolutely increase your risk of miscarriages. It can also cause a slew of other issues. So MTHFR can be a genetic component that might be important to her.
It seems coming off of the hormonal IUD. Okay.
I'm so sorry she's dealing with that. That's a lot. And also too, IUDs, intrauterine devices. So those two, usually that's either a copper or a progesterone base. The most common one's Mirena, which is progesterone base, has a lot of progesterone in it. And those kind of stick within the cervical, within the cervix. And so it decreases contraception, but it's slowly given to you. It lasts about 5 to 7 years. So with the removal of that, it can make you not feel good. And sometimes it does. And so sometimes birth control can make you feel good. It depends on the patient. But yes, I would say if I were looking at her too, remove it first and then wait a few months and then check your labs. That's how I would do it. Wait until your body kind of gets into at least 3 months before you check that lab again for removal of any sort of birth control like IUD. I'm sorry she's going through that. That's a lot for her at 24.
T-Von, I hope that helps a little bit. And thank you so much for being with us tonight and asking the question. We're going to move over here. We're going to get to Facebook and YouTube. Evangelon's in here. What's going on, man?
Yes.
I love it. Robin Crusoe. I like that comparison. I'm not sure who that is.
Robin Caruso?
Who's that?
Robinson Crusoe is like a book. It's a book.
I don't read.
Robinson Crusoe. Yes.
don't read.
Thank you. Like
I
in
don't
the picture.
read.
Yes. Robinson Crusoe. Thank you. I have not gotten that yet. Yes.
That's cool.
Ben doesn't like to read unless it's the 4 Hour Body or Who Moved My Cheese.
Yeah. I love it. I love it.
One time I got very worried about Ben. There's
I
a
know.
lot of self-help books out on that bookshelf. I thought, let's get some Harry Potter in here, everyone. I did. I tried to give you Harry Potter.
I tried to read it.
But it
Couldn't
made past
get-
chapter 1.
couldn't get
He
into
didn't understand. What a muggle. Am I right?
All right, let's get to one step forward here. One step forward. Thank you for being patient with us.
Yes.
I get to Cleveland every year. However, I want to work on my inflammation. Is there a specific test I could do, then recheck after modifying diet/supplements? If so, how much time between the test? Goes on to say, I had prescription for colchicine, but started having some side effects. Thank you for y'all. Thank you. Thank you
It's
so much.
awesome. Yes. Ben, I think you do an awesome job with this podcast too. You really do.
Thank you, man. I appreciate that.
And can I get a what?
What?
Ben does great with this. Hey, one step forward. This is a great question of how often we repeat this. So repeating Cleveland's every year is great.
Yeah.
It does have an inflammatory panel in there. And the inflammation panel on a Cleveland is going to include LPPLA2, myeloperoxidase, oxidized LDL, and then my favorite, which is more repeatable, is high sensitivity C-reactive protein, HSCRP. That's going to be systemic inflammation. It's very sensitive, but non-specific to what that inflammation is. But that would be the marker that I would repeat, and I would repeat after 3 months of changing diets, supplements, seeing Lucas. He does very anti-inflammatory nutrition supplements that people do. Your colchicine is very anti-inflammatory, which is great. And you can check a uric acid with that too. Uric acid tends to go down with colchicine. But I would check high sensitivity C-reactive protein. There's another one called SED-rate, ESR, that's a little bit more orthopedic in nature, but that's also another inflammatory marker that you can check. It's a little bit easier to check than the other ones. When you're rechecking Cleveland, just as a note, you don't need to repeat the genetics. So I would tell them if it's a repeat Cleveland, because that can increase your cost for it, or increase the insurance reimbursement when you're checking that through insurance. So you only need to check MTHFR and ApoE once. But I think repeat Clevelands every year are great. Short answer is HSCRP every 3 months. See how you do.
One step forward. Thank you so much for that question over on YouTube. I see Jessica is in here over on Instagram from Apple Healthcare. Shout out to Apple Healthcare.
Hey,
you guys
an
are
apple a day.
Y'all are such an inspiration to us, and thank you guys for all that y'all do. We love working with you guys. So thank y'all for being here. Thank you, Jessica. Let's get to Hammer Dude. What do you recommend for sleep apnea? What's your thoughts on this?
Prayer. I'm just
Yeah.
kidding. Yes, no, I'm totally kidding. Hammer dude. So yes, honestly, if it's true sleep apnea and you've tested for it, there's at-home tests that you can do that checks a pulse ox on your fingertip. And then there's also in-office tests that you can do where you go and sleep in like a sleep lab with a sleep specialist, and they call that an in-office sleep study. Sleep apnea means that you are not breathing. You're becoming apneic, without breath at certain times throughout the night, and they measure it within the hour. So our dad just went through this and did a podcast on this. So you have certain apneic episodes per hour, and a certain number of those gives you a diagnosis of sleep apnea or not sleep apnea, or more than likely sleep apnea or not. There's 2 different types, central versus obstructive. Most often it's obstructive. Central means your brain is not telling you to breathe. Obstructive means something is in the way of you breathing. Most often it's obstructive. And so it depends on so honestly, with recommendations, it depends on the type. More than likely, it's usually obstructive, and you got to open things up. And honestly, it's CPAP.
Yeah.
So a CPAP is going to be a device that opens you up. BiPAP does both ways. CPAP does one way. So a CPAP is going to shove a bunch of oxygen up to, it's going to open you up, and it's going to open up the airways and push the tissue back that needs to be pushed back so that you can oxygenate at night. Usually there's a nasal version, a full mouth, or kind of an intranasal that just is like, one covers all the nasal passages this way. One's like these little tubes that just go in, and then 2 one's a full face mask.
Yeah.
2 other ways that if you don't want to go for that, for sleep apnea, people will get their, they'll go to a sleep specialist or a dentist, and they'll get their jaws, almost like this device that goes in the lower jaw that pushes the jaw forward, because sometimes it's the placement of the mandible that will kind of push back, and you can push that forward and it'll open you up at night. Some people use these intranasal devices too that aren't necessarily airflow, but just open up the nasal passages through breathe right strips. They'll tape their mouth shut. Technically, a lot of people sleep like this.
Yeah. Yeah.
Have you seen people on the plane like that? Yikes. How many spiders they've eaten at night. Yikes. That too, it's all obstructive. So a lot of it is sleep position too. So I'd say CPAP is probably the way to go. And I think they change lives. I absolutely do. You can, I don't want to say that's like you can die from sleep apnea, but you can. So it's a really, I think it's something that we don't take as seriously. It's like, oh, you kind of snore. Are you breathing at night? You're going to feel way different the next day if you get something, if you actually get your pharynx open, if you open yourself up.
You know, we've had a lot of conversations with friends, and this seems to come up a lot. This is a more common problem than you realize, and you're right, it does change lives. It really does.
It does. It would change the way, if you oxygenate at night, your brain needs glucose and it needs oxygen. Needs omega-3s, EPA, DHA. You're going to feel different with oxygen.
Thank you, Hammer Dude, over on YouTube.
It's airflow.
Let's
it's
get
not
to
an oxygen tank. Did I say that?
Yeah.
Okay, you don't have oxygen. It's airflow, but you're going to have more oxygen.
Thank you, Hammer Dude, over on YouTube. This is Karen's question.
Karen, this is a good question.
I love this. Now, so the question is, how do you come off pantoprazole that you've taken for years?
It's tough. Okay.
Now, is that a PPI?
Yes.
Okay.
Look at you, Ben.
Okay.
Medical knowledge over here. Mr. Encyclopedia. PPIs, omeprazole, pantoprazole. So those inhibit the production of protons. So proton pump inhibitors. So you're decreasing hydrogen within the gastrointestinal tissue. It kind of creates a slip and slide. The only time we really like using those is with Barrett's esophagus, because if you're decreasing the acid and the acid is then going up to your esophagus and changing the cells, it's either squamous to columnar or columnar to squamous, I forget. That's cancerous. So that's actually something that it's better to be on a PPI than not to be on a PPI. Otherwise, it can have a slew of problems because you need acid. Acid is good. You need a certain pH within your stomach to be able to digest foods. So how do you come off of it? It's tough. We have some practitioners that can help you with our gut specialist is Margot. Margot and Robin work with gut health, and they can help you wean off of those. So honestly, it's weaning off. It's using lower milligrams and then using lower milligrams less often. Almost think about it like coming off a Zoloft or like coming off a medication. I would take it very slow. I would decrease the milligrams, maybe start using it every other day or twice or 3 times weekly. And then I would start replacing with some natural products. Slippery elm is one that comes to mind. Look up DSG. DSG slippery elm. That's the one that I've worked with that Robin and Margot told me about.
Okay.
That helps out with that. Or even like ranitidine, doing an H2 blocker is probably a little bit safer long-term than PPI.
Okay. One thing Doc talks a lot about is the betaine test, just to see if you have enough acid in your stomach versus not enough. Karen, thank you for bringing this up.
That's a great one. It's apple cider vinegar. I think that stuff for gut health is good.
Such a great question, and it's one of those things where
start now.
Yeah,
Karen, I'm sorry, that's a tough one, but starting now, that will help. And look up slippery elm.
Thank you, Karen, for that. Let's go to Robert. I have metastatic carcinoma secondary to prostate cancer. I'm so sorry, Robert. I've researched the Joe Tippin protocol. Have you heard of Fembim Lab from Lithuania? First of all, we're thinking about you. Thank you for being here. So the Joe Tippin protocol is around fenbendazole. Have you heard of the Fembim Lab from Lithuania?
I haven't.
Yeah,
I haven't. That's new to me. I'll have to look that up, Robert. I'm so sorry. But yeah, for those of you that don't know, fenbendazole is kind of an alternative or a complementary treatment to some of the traditional. We've talked about that earlier in this episode of chemo, radiation, and surgery. Those are 3 ways that are traditional ways to get rid of cancers: cut, burn, poison, kill it out. But a lot of those come with some side effects too from it. So when we're looking at metastatic carcinoma, that means it's spread. So we're not just sitting in the primary organ, which is the prostate. I'm so sorry you're dealing with this. Fenbendazole has some good results for decreasing the cancerous cells. Two people will go on, there's someone called Crispy something that is a nutritional pattern or nutritional plan. There's a lot of juicing that helps out with starving cancers. There's a book called How to Starve Cancer.
Yeah.
That's another good one. People will go on a ketogenic diet and with artemisinin. I have not heard of the particular lab from Lithuania, but too, I would try anything for that.
Robert, I hope you come back. I hope you, we do this every single Tuesday from 7 to 8. So keep us posted with how things are going. And we do get a lot of questions around fenbendazole also.
We'll look that one up.
Yeah.
We know to look that one up from Lithuania.
We're going to make a quick note of that, Robert, and we'll see what we can do here. Thank you so much for being here. Let's keep going here. Get to as many as we can tonight. Thank you guys. We got 55 people in here. Thank you guys so much.
Thank you for spending this Tuesday evening with us.
Yeah, this is amazing. I'm gonna put this up from Roel. Roel's with us every week, and I believe last week he mentioned he's getting on testosterone.
That's awesome.
I love the way you talk about TRT and is there any, for someone who's just starting, any advice you could give, like kind of general?
Yeah. So different ways of going about TRT. One is all natural. Like we have a handout on this in all the offices. All natural is going to mainly increase free testosterone. The mid-range is going to increase your natural production. It's not natural because you're still giving a prescription for it, but HCG and Clomid or enclomiphene will increase GnRH in the brain, which then goes to the testicles, makes more sperm, which makes more testosterone. So that's kind of the mid-range route. TRT is just going on the goods. You're just going straight on the hormone. You're skipping all the other stuff and going straight for the hormone, which is what's being tested on a lab. I'd say advice for TRT, especially for starting out, is to kind of start low, go slow, see how little you can get away with. Because some people want to hammer it out of the park in the first week. And I think it's sometimes you get to chase it. Have you ever chasing the dragon?
Yeah.
It's like, oh, what that feeling again? It's like sometimes you don't get it and you feel like testosterone's not working when really it is working. It's just you don't feel like, it doesn't feel like the first time. Feels like the first time. Okay, so.
I love it.
Thank you.
Yeah, that worked.
That
really worked.
That felt like it.
Yeah, okay. I like that. That hit
good.
I like that.
But also too, I have a lot of guys, a couple of patients actually, they go right off the bat of mitigating every side effect that you can possibly think of. Testicular atrophy or shrinking of the testicles, they'll go ahead and start taking a low dose Clomid or HCG in combination with a lower dose testosterone. They'll go ahead and split up the doses and do almost like daily or every other day testosterone injections. So that way it's very controlled in these small micro injections. It's more cumbersome, but typically you get the best labs that way because you're trying to match what you actually were doing whenever you're making testosterone. They'll go ahead and take zinc and DIM so that they're blocking estrogen conversion through aromatase. And then too, they'll donate blood once or twice a year, just right off the bat. So that's something that you can look at. It's like, how do I not get any of these side effects? That's how I do it.
I'm going to put his...
Or lower your risk for it.
So Roel had a more contextual question here. Thank you, Roel. Will TRT hurt someone with type B pattern cholesterol and small sticky pattern in the blood?
So type B tends to be stickier rather than bouncier like pattern A. No, it will not. Okay. Two, you just want to make sure too that we're not making the blood too thick. Testosterone's relationship to blood and heart disease is going to be through hemoglobin hematocrit. It doesn't cause heart disease, but it can thicken the blood. Testosterone goes to the bone marrow, says make more red blood cells, and you got to clear them somehow. So if your body doesn't naturally clear that hemoglobin hematocrit, the red blood cells flushing out of the system, then too, that can cause some problems with other things. It's almost like you're adding more onto a crowded highway in Knoxville, which I'm learning there's a lot of traffic here.
Yeah, there's a lot of traffic here.
There's a lot of traffic.
St. Johnson City.
St. John's City. But yeah, so I would say looking at the hemoglobin hematocrit, being a little bit more forward with that.
Roel, thank you so much. Hope you're doing wonderful down there in Texas. I'm going to get to Chuck here because I love this question. The big problem that we're seeing with the GLP-1s and the GIPs is the insurance coverage. Chuck's question is, have you heard anything about when the Mounjaro shortage is going to get better? BCBS finally approved me, and I can't find it anywhere.
That's awesome. You got approved.
Yeah,
though.
it's incredible.
That's awesome. They have not given me a specific date about when it's coming back out. To Mounjaro and Zepbound, see if the pharmacist would give you one or the other or something in comparison to. That instead of just waiting on Mounjaro. Sometimes pharmacists are really good about being like, I can't give you Mounjaro. Zepbound's exactly the same thing. I might have that same dose right there for you in the pharmacy, and shopping around as much as you can. There's always compounds as backups. I think if you have coverage, it's a price game then, because if you have coverage for Mounjaro and it's been covered, then it's going to be cheaper than the compound. I'd go for that. I'll ask the rep if they've heard anything different. They've not told me anything in Knoxville, at least, or in the Johnson City clinics. They haven't said. And
that's something we're going to keep our ears to the ground on. And Chuck's in West Knoxville, and I want to make sure that we just, you guys will hear it first as soon as we have a better idea. But that's kind of an issue, with these
people want
the GLP-1s. Chuck, I hope that helps a little bit. Like I said, we're gonna keep our ears to the ground on
and
this one.
See about Mounjaro is awesome. See if there's at least something, because there's Mounjaro, there's Ozempic. If you're looking at it for type 2 diabetes, you're looking at Mounjaro, Ozempic, Victoza. Some of the older ones, Trulicity, even though I'm like, you want the one you want, sometimes I might give you something as an alternative just to keep you going until the Mounjaro comes back in. And a lot of it's dose dependent. I've had troubles with like 7.5s.
That's interesting.
I've had trouble with the half doses.
Huh. Okay.
7.5, 7.5, 12.5.
Chuck, thank you for being here, man. As always, love to see you.
Yes.
Let's go to, I see Angie in here from Kingsport. Angie, we love you. We love you.
Angie.
Tabitha's in here. Tabitha just came in.
Oh, no.
I love you guys.
Shake that shoulder, Angie. Shake that shoulder.
Thank you guys for hanging out.
Yes.
All right, let's get to Vicky's question. Vicky, thank you so much. Is it normal to have bowel changes when using perfect aminos, such as less often and lesser amounts? That's interesting.
No, too. I haven't heard people complain. That hasn't been like a chief complaint that people have told me about, but I can see when adding more protein that it can change bowel movements. Or two, whenever you're changing anything nutritionally. I would say two, coupling perfect aminos with making sure that you have enough water with it is a good thing. Whenever you're really getting high potency proteins, you want to make sure that you're able to flush those proteins out with enough water, because sometimes with protein clearance through the kidneys, I know that doesn't deal with bowel movements, you want to make sure water is there too. So I'd say really crank up the heat on water, and that hopefully should help out with some of the movements with less often and more of an amount.
Vicky, thank you so much. That's a great question. Thank you for putting that in there.
Yes. Sorry that it's kind of a piecemeal one, but it's not something I get all the time. But can I see that happening? Yes. And it might be that you use perfect aminos maybe a little bit more judiciously at the beginning and really cranking up the 100 ounces of water or more a day. Yeah, I know that what they go for is 64. Go for more. Go for 100 to 120. It's a lot of water. It's a lot of water.
It's a lot of water.
It's a lot of water.
Yeah.
Ben, okay, can we just talk about this? We need to get Ben a new water filter.
Do you not like it?
Okay, it's so slow.
It's a little slow.
It's like I'm waiting. It's like I'm at the well.
But you know that water's it's like spring water.
And it's like I'm waiting at the well for this water. It's like, are we?
I want to put this up because first of all, I love when you guys do this. When you guys notice something with a question that's really working for you or someone else. This is in regards to the FemBin question with, I believe it was Robert. So Margaret saying Happy Healing Store was highly recommended also for artemisinin. It's located in Wake Forest, North Carolina. I don't know if that helps you, Robert.
That's awesome.
But Margaret, thank you.
What a good community.
I love that.
That's great.
I love that, Margaret. Thank you so much. All right, let's see. I think we're through. I don't think we've missed anything. I'm gonna put this up from Peggy. Thank you, Peggy, for that's awesome. That's awesome. You do a good job of that.
Oh, Peggy.
You do a great job with psoriasis. You really
Thank you. Psoriasis, it's a beast. It's a beast and can come when you don't want it to come. Yeah. So yeah, it's a tough one.
Guys, any last minute questions before we head out of here? I love this from Stephanie. Thank you so much.
Oh, Stephanie. Yes.
You know,
You're such people.
you're heading to JC
I
either
will
later
be
tonight
there.
or early in the morning.
I will be there in the morning.
He will
I
be
will.
there
I
tomorrow.
don't know if you saw, I have my wake up call from Carter coming at 9 a.m. I'm going to wake up at 9 a.m., be there at 10:30.
For
I'm
those
just kidding.
For those interested, I'm going to put this up. We do have an online vitamin store. This is where we have all of the Dr. Rogers formulas. And
10% off tonight.
10% off for the next 48 hours.
8 hours. Man, that's 2 days in some countries.
Live Q10 is the code, guys. If you guys want to get a 10% discount, this discount code changes every week. I don't know if this is your time. You want to get some vitamins. If you do, we have a store for it, performancemedicine.net/shop.
CoQ10 with Live Q10.
I love it.
Ladies and gentlemen.
Let's get to Kathy here. Kathy saying, you mentioned red light therapy. Is there a lamp you recommend for at-home use? That's cool.
You know, I don't know of a particular, we've got a handheld device. What's the handheld device that I'm going to Google this? Mom has a handheld device that she
Can we get
really
a text?
likes.
Can we get a text with the handheld one? Sunlighten is the sauna that I know we like. Sunlighten.
Yes.
What is that red? It's like
It's
red.
It's the handpiece. That's the one that I go to. I was supposed to look for it in our Knoxville clinic. Mom, can you give us a shout out if you're still listening? Because it's Mom's. That's the red light therapy I would look for. It's a handpiece. So the red light therapy gets expensive.
Yeah.
So I've seen them be like upwards of like 10 grand. I've seen really expensive stuff to get some high quality stuff. There's a handpiece. If we don't get on here before,
I'm looking for it now.
Because I was supposed to look for one in the Johnson City clinic. It's that brand. That'd be the one that I would use because you can use it on your face.
Oh, here we go. Man, it's a picture of Dad doing it, but doesn't show the brand.
That's what it looks like.
It looks like this. That's Dad right there. That's the device he's using at home. And we'll see if anybody.
No.
We'll keep you posted on this, Kathy.
It's that one. That's the one that I would get, and we'll put it on here, Kathy, for you. Oh, show the QR code in the side panel. Mom, no, hey,
that's not what we're talking about.
Mom, asking a question. We want to know what the brand of your red light handheld device is.
The red light. The red light. We haven't gotten it yet. The red light that Doc uses at home. The brand of that. While we're looking for that, she does want me to put this up. I'm going to do this. Because I think this is cool. We're getting a little high tech, guys. There's the vitamin store QR code. If you are on a desktop, check that out, and you'll see that. Again, use the code LiveQ10 for 10% off for the next 48 hours. I believe it'd be midnight Friday or midnight Thursday, where that no longer works. But there's the QR code right now. Shout out to the graphic team. I think that's so awesome. That's a really cool code. QR code. All right, let's see if we got it here. Okay, we're checking on the hand. Thank you. We're waiting on this.
The hand. This is good.
Kathy,
we're gonna get this for you.
We're gonna get this, Kathy. We're gonna get this, Kathy.
That's the one. I think it's a really great one.
We're waiting on Mom for this, and then we will head out of here.
These have been great
questions. Oh, there we go.
It's called Red.
There we go.
There it is.
Thank you.
Ella Barcia. Mom, wow.
Thank you.
Mom, happy Mother's Day.
Thank you. Happy Mother's Day. That was awesome.
Not only did you birth us, you birthed that question.
That was awesome.
Birthed that answer.
That was awesome. Thank you, Mama. Let's see here. Oh, there we go. Victoria. Thank you, Victoria. What milligram of dihydroberberine do you recommend daily? We've been talking a lot about dihydroberberine. It's the berberine max on the Dr. Rogers formulas on Performance Medicine. It's 200 milligrams. I want to say it's twice daily with your two biggest meals. Is what
250.
Did I just answer that question?
Ben?
Man, I'm sorry.
Ben? Regular.
Yeah, they're not here.
250 1 to 2 times daily. That's
Okay.
Is that what you said?
I said 200 because the 200 is the berberine max is 200 milligrams.
200 or 250.
200 250.
200 250 1 to 2 times daily. Both work really, really great, but yeah.
Oh, there we go. Victoria, thank you for letting me shine on that one. Let's get to Carol here. Thank you guys for these questions. What's the difference between red light and blue light therapy? We did an episode of the Skin Podcast with Jasmine Allman on blue light therapy. Blue light therapy is bad. That's bad, is the way I understand it. Blue light's bad, red light good.
Yeah, but then again, I've seen other stuff on that too.
Really? What is it?
I've seen blue light like different lights can kill different things. Like blue light's anti-inflammatory and can kill acne.
Okay.
And then red light kind of works on the mitochondria, and that's kind of like making cellular activation. I would use red light over blue light.
Okay.
That's kind of what I would say. Now, too, blue light therapy might be different from blue light coming from a computer.
That's
Is that
right.
what you're talking about?
I'm talking about blue light from the computer.
Oh,
that's my bad.
I was like, I haven't heard it being bad, but maybe I'm wrong on that.
That's my bad, Carol.
From my understanding, and I'll look this up too, blue light more anti-inflammatory. I have a skin condition. I'm trying to kill it.
Mm.
And then red light is I'm trying to activate my cells more systemically. That's how I've known it. But blue light from a computer is different. Where you can get those blue light glasses.
Hey, that's my bad.
That's okay.
They're not here for my answers. They're here for your answers, and that's exactly why.
No, that's so true. But yeah. I think blue light. I need to look this up to just make sure. But I'm pretty sure blue light is more killing, red light more activating. That's how I would differentiate those.
DPC is asking, do you take blue meth every day, and for how long? I know your answer.
Every day.
Yeah.
I love it. Yes. So I'm taking it indefinitely at lower doses or lower to mid-range doses. You can change doses depending on what you're looking at it for. So if you're looking at it for like an infection, you can double up or triple up the doses depending on what you're doing to kind of get rid of the infection and then go back to low dose after that. But you can take it indefinitely.
Thank you, DPC. I'm going to get to Instagram real quick. I see the handheld's called
Red by Elevare.
Red by Elevare Skin.
Okay,
I'm going to go back here. Let's see if I can find it here. There it is right there. Red by Elevare Skin is the handheld that we've used.
Yep.
I'm going to go, let's see, back to Instagram here. We're going to get this real quick. Why is CJC1? CJC1, I'm not sure, R.A. Duncan, about that one. Let's go back to...
it might be, why is it like, why can't you get CJC Ipamorelin anymore?
Oh, that's... Why can you not?
If that's the question, the FDA has not studied it, so they've put it on a I don't know what it is list, and they've called it kind of this like suspicious list. So they want to investigate it a little bit more before you can get it in a non-FDA approved manner.
Got it.
That's why. Samorelin, Tesamorelin, and maybe oral BPC. I'm pretty sure Samorelin, PT141, Tesamorelin have been studied before.
Let's get DPC blue light for psoriasis.
Okay. Yes, I've heard of blue light for psoriasis, which would be anti-inflammatory and antifungal, and I think blue light kills. That sounds right. Blue light kills, red light activates.
That sounds right.
That sounds simple. Yes. Yeah, that's great. DPC for the win.
Thank you, DPC, for that. Guys, thank y'all so much. This has been such an absolute blast, and I just want to say thank you, man. Like, this was awesome.
It's been an honor.
You absolutely did amazing, as you always do.
Ben, you're amazing.
You're amazing. Like, seriously.
What's that song called? You're amazing.
Guys, in the comments, tell us how great Andy was. Like, is he not amazing tonight? Give us a 1 out of 10. How did we do? I think we're done. I don't think we have any questions left. We're gonna call it a night. Let's see if I'm Instagram. There we go.
This is great.
There we go.
What a show, ladies and gentlemen. What a show.
I'm going to turn off the podcast here. We're just straight up live. Dude, thank you, man.
Yeah, hey, this is great. This is great.
From our family to yours, we love you guys. Tabitha's given us a 10. Connie's given us 2 10s. Connie's saying he's amazing.
Connie Sexton. Oh, Connie.
Don't do that to me. Carter's given us a 10.
Yes. God, I love Connie. You do not understand. I love the whole Sexton family. I do. I really do.
Guys,
You know I do.
We love you all. Thank y'all so much for being here. We do this every single Tuesday.
This is great.
This is my brother right here, and I love you, man.
I love you too, Ben. This is good.
We'll be back Tuesday, 7 to 8. We do this every single week. Thank you, guys. Thank you, Patra. Thank you, Donna. We love you. Ready to call it a night?
Let's call it a night.
Let's go get some dinner, man.
Let's get some dinner.
There we go. Calling a show. Brad, let's outro it, Brad. Where we at? Real quick, for those still with us, I'm just gonna put this up one more time. 10% discount on the vitamin store. Live Q10 is up for another 48 hours. I think it's Thursday midnight. All right, we're calling it a show. Thank you, guys.
Let's do it.
Where are we at? Outro, Brad.
Don't go away.